Hello, I am Dr. Farshad Amini Behbahani and this is short course of Iranian traditional medicine. In this section, we discuss about fear and anger. Fear is rapid movement of vital spirit toward inside of the body. By this movement, the feet and the hands become cold, and a lot of amount of spirit gathered in the heart. So sometimes by strangulation of the heart and by getting warm inside, this may be happened, especially in severe frightening. Fear almost always is not a good feeling. We try to manage it immediately by hugging the person who is frightened, or by bringing back or bringing outward the vital spirit by good smells or spraying water on the face. It could be sprayed by hand, and by using or by practice the similar situation. For example, earthquake simulation that prepare a person to, when faced with the fear situation, don't be afraid. Those who have experience of catastrophe are susceptible to fear. Those who experience sadness or fear in their childhood are susceptible to fear. Those with extra melancholic humor are susceptible to fear, and those with weak spirit or weak heart, those who have cold distemperament in their heart, are susceptible to fear. By exercise, by helping more production of spirit, we can help to prevent fear or its side effect. Anger, reversely, is fast movement of vital spirit toward outside. In anger also we have increasing in heartbeat and production of more vital spirit. Anger warms the body. Sometimes we use anger to treat some cold disease, cold distemperaments. For example, phlegmatic distemperament of the joint. But mostly anger also is a unwilling feeling. We try to manage it. Those who have extra sanguine humor or those who have extra yellow bile humor are susceptible to anger. Those who have warm intrinsic temperament are susceptible to anger. There are another simple feeling similar to anger, similar in movement. In severe joy also we have movement, rapid movement of vital spirit toward outside. But the difference is that in severe joy we have no more production of spirit in the heart. So the heart will be empty by severe joy, and sometimes this will happen because, if you remember, the vital spirit was responsible for producing heartbeat, and emptying the heart of vital spirit leads to no heartbeat. We can manage anger by some other feelings like shame. If you remember from the previous section, bringing the great or noble person or those elder person who we have shame of them or we respect them helps to manage anger. Because of shame, the anger will be suppressed. Another way of management is yelling, is force expression with a voice. At first, breathing deep breathing, and then saying loudly ah or who. This helps to manage anger, to bring the temperature down. The consequence of anger, the side effect of anger for body is called distemperament of the liver, weakness of natural spirit. Those who anger frequently weaken their natural spirit. We can use by asking duration and frequency of simple feelings to reach to diagnose of intrinsic temperament or distemperament or extra or dominant humors in the body. For example, about anger, phlegmatic dominance or dominance of phlegm humor, those people with dominance of phlegm humor, or those people with cold and wet temperament or distemperament barely become anger, and if they become anger, soon they forget, soon they become cool. And we can use anger for their treatment if they are ill. Those with extra sanguine or extra yellow bile humor are susceptible to anger. But mostly angeriness because of warm humor is short. But if there are any distemperaments of warm and dry distemperament, the anger will be more frequent and more stable, more prominent. Those with extra melancholic humor or those with cold and dry temperament barely become angry. But if they become angry, they barely forget or forgive. Also, we can use asking the other simple feelings to reach to diagnose. For example, those who are frightened or fear, especially recently, we could conclude that there is a weakness in vital spirit. For example, in coronavirus epidemic, we can see this fear this sudden crying, this emptiness of heart, sometimes warmness in heart. Frequently, that's because vital spirit become weak in this disease. We can help this fear by smelling good and cool smells, like rose water smelling, like washing face by spraying water, or by happiness, by asking joy. Those who are happy easily or become easily happy have a strong vital spirit or large amount of sanguine humor. Remember that happiness and joy is different from laughing or smiling. Happiness or joy is an inside feeling. Maybe some with happiness or joy smile or laugh, but not every laugh is happiness.